Morning, Mr. Manager.
Good morning. Two issues today. We're going to have Malachi Winters get up and talk about or give you an update on the integrated care team. And then we'll do an agenda review for next Wednesday's meeting. Should take 5 minutes or so. So, Malachi, you can start us up and we'll go from there.
Good morning, Malachi.
Good morning. Thanks for having me. So I want to give you guys a quick, brief update on the integrated care team, which will be rolling out at the end of this month. We are busy, very busy right now, doing the final steps of getting everything up and ready to go. Again, for review, the integrated care team is going to be a multidisciplinary team consisting of a mental health professional from ComCare, a law enforcement officer provided from either Wichita PD or Sedgwick County Sheriff's Department, and a paramedic that is provided from either EMS, County Fire, or City Fire. And those kind of rotate. We have the schedule all laid out and all the individuals chosen.
Did you say it was paramedic or EMT?
Paramedic.
Paramedic. Okay.
Yep. Here is the vehicle that they will be driving around in.
That?
Yeah, the red van. This belongs to Wichita Fire, but it is a non-branded vehicle. The only brand that's on it is the Integrated Care Team, the ICT-1.
That Wichita Fire thing?
Yep. Yep, that would be Tammy Snow to thank for that. It's outfitted. It actually has emergency lights if they have to ever park in traffic or anything like that. It has a radio and all that. And we're going to have all of our equipment in the back and be able to transport one person if we need to. This is a timeline of this month of all the steps before we go live. The big ones that I would note on here is on the 16th, which is today, currently across the street in the city building. This is going before their city council for approval of the MOU. That same MOU contract will be presented to you guys on the 24th for approval from the BOCC and from the fire board. Training of our medical providers, of our paramedics, starts tomorrow, where we're going to be giving them in-depth training on mental health emergencies, specifically schizophrenia, bipolar disorder, anxiety, and personality disorders, which are going to be kind of the meat and potatoes of what they're dealing with from a medical standpoint. Obviously, you have that mental health professional that's there to add their expertise, but at least evaluating what medical needs they need to go along with those. We're going to hit those in depth. We're also going to be looking at drugs of abuse, particularly alcohol, methamphetamines, opioids, and synthetic cannabinoids like K2 or Spice, or those trendy ones. Starting next week, we are going to start doing integrated training days where we'll have all the members of the team together, and we'll do some simulation in the sim lab at OMD, and then we'll actually go out and do a soft rollout and start responding to some calls and figuring out how to work out the kinks and iron things out and make everything run smoothly before we go live on July 30th.
Okay, before we go away from the timeline, I need our communications folks to work with the city of Wichita sometime either the afternoon of the 24th or sometime after that, so that we can get a press conference put together, a big rollout for this with our folks from EMS, fire, sheriff's department, and from police department and fire from city of Wichita, so we can have a big announcement and let them know what we're doing here. This is important.
Mm-hmm. So I think it would also be nice. It would be nice if we could have communications come over on the 22nd to OMD while we're doing our training and shoot some footage and get some stills, and maybe even watch us go on an actual response or two. That might be nice as part of the package for rolling out.
Yeah, I think this is a great program. You're going to talk a little bit more about it. I'm not trying to cut you off, but I want to make sure that we get the word out, and that's the point I've got. In this timeline, someplace we need to make sure that the word gets out that we're actually doing this.
Absolutely. I very much appreciate it.
I have a question now.
Yes.
I thought we were going to try to work out the kinks before we're going to roll it out to the community. Did I hear that, or was I...
So we have a good idea of how many kinks that we've rolled out, as many as we can before going live. However, once we actually do start responding on calls, there will be certain things that we're not aware of. And that's why we're going to be responding to a few calls on the 22nd and on the 26th to kind of a lower key, non-official. We're not piling 10 calls on top of them, but doing a little bit slower and a little bit more methodical and have time to debrief afterwards and say what went right, what went wrong, what can we improve on, what do we want to repeat, and that way it's a little bit less pressure than just flipping the switch as you guys are ready to go on duty. So soft rollout on those days. Does that answer your question?
Yeah, I don't disagree. We need to have an information to the public. I had heard that somewhere about maybe kind of launching it and then figuring out and then launching it to the public. So
Yeah, the integrated training days on the 22nd and the 26th are going to be our days where we're.
kinks out.
Yep, absolutely.
Okay.
And that's with working with 911 also on all of that.
Correct.
Right.
Yep.
They'll be trying to analyze these type of calls. This is what we think would be good for this
Yep.
team.
Absolutely. And this will continue to evolve as the team gets experience, and we'll be constantly adapting. The next very busy slide is the metrics that we're going to be tracking. The first chunk of those where it says the disposition of the call, this is how it's logged in CAD as they clear a call of the possible different endings of the call, what happened. And this is what we're going to be closely tracking. And you can see that goes from everything from we never found a patient, we were canceled prior to arrival, all the way up to transport to either St. Joseph or to ComCare Crisis Unit or SAC, and then everything in between as far as treat-in places. And those are the different dispositions. In addition to that, we're going to be tracking the number of emergency response units, whether that be law enforcement, fire, or EMS, that were freed up from mental health calls because this team was able to take over. We're also going to be tracking how many visits to the crisis center were averted, as well as visits to the emergency department that were averted, and tracking the number of patients that were treated in place. Again, the other systems that have done this found about 60 to 65% of their patients they're able to treat in place without actually transport to anything. So we hope to replicate that. We hope that it works out the same in this system. And then the number of times that we administered medication and how many field medical screenings were performed. And then finally, we're going to be watching those that we did do a field medical screening on. And if they seek medical help for a medical problem, not a mental health problem, within 48 hours, that's a red flag for us to reevaluate our medical screening.
And so, what day are you coming back to us and telling us all the answers that you can put down here that you're tracking?
So my intent is to have weekly reports that are sent, that are emailed out to all the stakeholders that need to be of what these numbers are and how they're playing out, so you can see it in pretty close to real time as it's evolving. So we're building it up front where we can get those reports and have it compiled and sent out on a weekly basis.
Okay, and again, how long is this first phase?
90 days.
90 days.
So it'll begin on July 30th, and the last day of the pilot program is October 31st.
Okay, and at that time, you're going to make recommendations based on these metrics on what we go forward. So actually, you're going to have I would hope, a report before August 31st, some interim report where we can make a decision.
Absolutely. I would love to come back early September and show you guys how great this program is doing and continue and have that conversation at that point. Earlier is better, in my opinion.
Well, I don't want to go down August 31st and then say that we're going to continue it, but we haven't got any plans to continue it. So we need to figure out what we're doing a little bit earlier than October 31st.
Oh, absolutely. Absolutely.
Yep. Other questions?
What are the shifts again?
The shifts will be Tuesday through Friday, starting at 2 p.m. and ending at midnight.
What time does it end, did you say?
Midnight.
And that's based on.
And that was
Tulsa.
based on the highest potential call volumes. So we looked at it across the week and when the most of these type of calls occur, and it was that time frame, Tuesday through Friday, in those hours.
Okay. Questions?
Yeah, I have a couple questions.
Sure.
So, based on who's approving this, I assume you have Wichita Police Department, Sedgwick County Sheriff's Office. Those will probably be CIT trained, I assume.
Yes.
But that's two law enforcement two law enforcement agencies, different governing bodies, so different budgets, if you want to think of it that way. Wichita Fire Department,
Yes.
because they provide EMT.
They're providing paramedics. which is a level above EMT.
Wichita Fire has paramedics. Okay.
They have a few of them. They have 8 in their whole service.
Sedgwick County Fire District number 1, EMT.
Paramedic,
Okay. And then EMS, paramedic.
yes.
And then ComCare, psychiatric help at the scene.
Yeah, qualified mental health,
Mental health.
worker, somebody that works in the crisis center is being donated to.
So it'll always be a paramedic in either case?
Yes.
Okay. And, okay, I mean, I have to think about that for a bit. And then you guys will, it sounds like you guys will be doing involuntary transports?
Involuntary but cooperative. If it's somebody that is not cooperative and they need a cage, then they'll be transported in a law enforcement vehicle, in a police car that's designed for that. Although there are some people that will be involuntary holds that will willingly go along and cooperate, those would be a target for this team. But somebody who's actively, aggressively fighting, that's not a target of who we're looking for.
Okay. So just one of the things I'm curious about is the financial side of this, which is, you know, devil's in the details. How, when you have 3 different governing bodies trying to provide professionals to this, it could be Wichita, Sedgwick County. It could be Wichita, Sedgwick County Fire District number 1, and Sedgwick County again. So I mean, there's different teams on the financial side of this. How is that going to be handled on the budget side of this?
So right now for the pilot, the budget is being handled in that every department has set aside a certain amount of their own existing resources to fund the pilot. Different days will have different staffing and different resources depending on who's on that day. That's part of the reason why we put together the contract, the MOU of understanding, to kind of cover our bases that if you had 3 county employees and a city-owned vehicle, are they allowed to drive it? Yes, those type of things were covered and laid out in the contract, which you'll see on the 24th. Well, you'll see it before then, but.
And I guess it's just more of a comment more than anything, but I think one of the challenges we have in providing mental health in the field is there's a stigma that people are embarrassed about having an ambulance show up in front of their homes, for example. And I guess I would have preferred this to be more of a unmarked vehicle, but that's just me. A red vehicle shows up and it looks like the neighbors start asking what's going on. That actually is a deterrent to someone wanting that type of help. So just in the future, it'd be nice to have at least a discussion about, potentially making this maybe a vehicle that's a little bit less noticeable. But that's all.
Oh, thank you.
Thank you for the brief.
All right. Any other questions?
I would just counter that, Commissioner. This was extensively discussed about what kind of vehicle and what should it look like.
Okay.
And the red got a little bit of emergency to it, but as you see, there's no logos, there's no sheriff, there's no police, there's no 911, and so from my perspective and from all the dialogue that was going on in all the meetings, this was an agreed from the experts that were there, including the ComCares and everybody else have been part of this. They were there, and this was what was done, or what they recommended, and so.
I just have one follow-up. I mean, when someone calls 911, you kind of expect for an emergency vehicle to show up. I mean, you call ComCare their mobile crisis unit and you schedule an appointment, perhaps you don't want somebody in a marked vehicle to show up. I mean, I think that's the more discreet version of this. Correct me if I'm wrong, but if I call 911, I want somebody showing up that's, a professional. That's what I would say to that.
Well, in just the smallest final, so they don't know until they get there if they're going to need eventually some flashing lights and emergency type stuff.
Right. Typically,
until they can analyze.
Typically, we wouldn't be using the emergency lights except for if we were parking in traffic. Sometimes people with mental health crises wind up out in the middle of the street publicly having this, and the only place to park is in the street, and therefore the need for the emergency lights as a safety measure.
Right.
And when that's dispatched, you're going to get closest and fastest, and then ICT rolls in to support the officers or the deputies, whoever's out on site. The reality of that is you're going to get somebody closest and fastest on these kinds of calls.
Very good.
I think along with these metrics to be measured, you might want to add on there, the types of services the paramedic specifically provides. If an EMT would suffice this in the future or not, that's a good question, whether or not it needs to be a paramedic or an EMT, because there's a lot of firefighters that are EMT qualified. There's not that many that are paramedics, and so I just am, in the future, if an EMT would satisfy the trio, it might be nice to have that data.
Oh,
after the
absolutely. And
pilot.
if the data plays out that way, then yeah, I'm absolutely open to what the most efficient model is. I'll say right now, the one reason that we need a paramedic is that there is the potential for them to give medications to calm people down. They can give Haldol or Benadryl in order to facilitate a more calm transition to care. And so that's something that only a paramedic can do, and that's what the one scope limiting thing that we have.
Thank you.
All right. Thank you for your time.
Thanks, Malachi. I appreciate it. We look forward to this kickoff.
Okay, you all should have a copy of the agenda for next week, but before we do that, I'm going to just talk through the meeting tomorrow very quickly, because we expect that's going to be an extended meeting. And I know we had some question this morning about KPTS coverage on this. So the meeting starts at 9, and of course we have a land use issue that will take up considerable time, and then some other routine types of agenda items. KPTS will run until 1 o'clock. We have confirmed, correct? So I think the plan is to get through all the way up to budget discussion and then take a lunch break in that time period. So, that's somewhere between 11, 12 o'clock potentially. Then take a lunch break, then reconvene and cover budget after that. So is that okay?
That's the plan right now, but we'll have to play it a little bit by ear as we get to that point to see where we're at.
Okay.
I have no idea how long that first land use thing is going to take.
Right. Well, we will be ready to roll into budget in case you want to do that before we do lunch break. So, okay. The agenda for next week, we have an initial proclamation regarding Veterans Awareness Expo Day. And then we have a series of appointments for MABCD, which is commission appointments as a body. And then Commissioner O'Donnell has an appointment to the Mental Health Advisory Board. On new business, the 24th is our first public hearing for the budget, so that will be the first item on new business. Then a grant consideration for aging and disability. The $100,000 contribution to KVC is on the agenda for a vote. I talked with Mr. Layton at the city. Wichita's, I don't know if it'll be next week, but on an agenda soon, they will also consider a matching amount for the same hospital. And then I think I heard Malachi say ICT 1 has to be on the agenda next week. We'll need to throw that in here too. Is that right, Malachi? We want something? 24th as well. Yeah.
It's on consent.
It's on consent. Do you want to keep that on consent, Chairman, or do you care? Did city put it on consent today, Malachi? Do we know? Yes. Okay.
That's not on consent right now.
L,
Yeah, I don't want to put it on consent.
you want it on new business?
Yeah, that's where it's listed here, right?
It's on, I'm seeing it on consent item L.
On consent. No, consent.
Oh.
It's to approve the agreement, the intergovernmental
Yeah.
agreement.
Okay.
We can talk about that offline, but
I don't know if I like it on consent because we're trying to get the word out.
okay. We can discuss that between now and Friday.
Yeah.
And then the rest of consent is, unless Mr. Spears wants to tell me K is going to be a problem, I think it looks fairly.
Where's the purchase of the land for fire district?
That's on fire. That's on the fire agenda.
Oh, I'm sorry.
We'll do budget on fire as we roll to fire agenda. We'll also do the budget. That's a public hearing for the fire district number 1 budget. We are going to be accepting a some cash from Textron on a contract, or a fire contract issue, the land purchase for Station 31. And I think that item D is also 31, correct, Tanya? Both C and D are related to the Andale fire.
Very good.
And it also has to be on consent here because there's fire department involvement in the ICT program. So.
Any questions on the agendas? What else you have for us?
All I had for
That's
today.
all you have?
Yep.
All right. Any commissioners have any questions this morning? Don't see anything. Any staff? Electeds? Nothing? We're getting ready to go into some elections here pretty quick.
Sure, I can give an update. Today is voter registration deadline for the primary. And tomorrow we begin mailing ballots. I think we're sending around 4,700 ballots, which is about 500 down from what we sent in 15, which would be the last mayoral primary. Registration in advance by mail numbers don't indicate that we're going to see an increase in turnout coming into this election over 2015, which is sad. But that's what it is. So that election is August 6th, and then we have another election August 27th. We actually already started sending military and overseas ballots for that election because it's only 3 weeks away after May's school district has a bond election. And then, of course, we will have November 5th election as well, which will be countywide.
Did you say when we're going to open the advance across the street?
Monday.
May 8th.
Monday for
Monday.
the primary of this Monday. Yes.
Very good. And when do the other ones open? The other
They
advance?
will open the Thursday, Friday, and Saturday before the election. So in August.
Okay. Any questions about the election? All right. Thanks, Tabitha. Anyone else have anything this morning? All right. I guess we're adjourned pretty early. Thank you.
20 minutes.